Great. Good morning, everyone, and welcome to the Alzheimer's Disease and Related Disorders Advisory Committee meeting. We're just giving our guests some additional time to get logged on and settled in, and we'll start shortly. And just a few logistics reminders as we continue to meet virtually. This meeting is available by computer, smart device, or telephone. And American Sign Language interpretation and closed captioning is available. So to enable your captions, please select the CC icon from your toolbar right at the bottom of your screen. And ASL interpreters will be spotlighted throughout the meeting. And please note that the session is being recorded and it will be available and posted to the California Health and Human Services Committee page within the next few days. And you can also visit that same Cal HHS page to find an archive of past recordings and presentations. We are saving time for Q&A and public comment at the end of the meeting, and there will be a 15-minute break at 11:30 a.m. So during public comment and for any Q&A you have, we of course welcome your written comments at any time via the Q&A feature located at the same bottom of your toolbar. You can also join the queue for a verbal comment by selecting the raise hand icon, and your line will be unmuted during the Q&A period. And if you're joining us by phone, you can select *9 to be added to the queue. And while we may not be able to respond to every single question today, we will be sure to record this and all of the feedback provided today. And at this time, I would like to welcome Darcy Delgado to do some opening remarks.
Great, thank you so much. Hi, everyone. My name is Darcy Delgado, Assistant Secretary with Health and Human Services, and really excited just to welcome everyone before handing it over to Catherine Blakemore, our committee chair and family member representative. So wanted to welcome everyone on behalf of Secretary Mark Galley, who is really looking forward to meeting many of you in person on September 20th for the big event that's hosted by the California Department of Aging and folks who work with the Master Plan for Aging. That event is incredibly exciting. If you haven't heard about it yet, hopefully we will throw a link in the chat for folks to be able to register to attend virtually. But just very excited to meet with everyone today. Want to start by thanking everyone for their service on this committee. Alzheimer's disease and related dementias are such a difficult topic to be talking about. We know in this space, people with lived experience, family members, and so hope that this is a safe place for folks to share their experiences and also help us at the state level really understand what the priorities should be and ensure, hold us at the state accountable to ensure that we are doing everything we can for this population. Thank you not only for your service in today's meeting, but all of the work that's happening in between these meetings. We know that, we will be highlighting multiple things today and work that the committee has been doing, but that there is a lot of work happening behind the scenes, so just want to acknowledge and appreciate that. So without any further ado, I'll hand it over to Catherine. And just again, thank you all for attending and really excited to hear about what's happening today. Catherine.
Terrific. Thank you. Good morning, everyone. Welcome, everyone, to the September meeting of the Alzheimer's and Disease and Related Disorders Advisory Committee. It's nice to see everyone. We're going to take a couple of minutes just to do introductions. As you can see, we're all back in Zoom again as our meeting mode. That is the result of a bill that was part of the budget that extended the COVID flexibilities about using Zoom as the only meeting opportunity. So this will continue through until right now through June 30th or July 1st of next year. So our meetings will all be in Zoom. And I'll just introduce myself. I'm Catherine Blakemore. I am the chair of the advisory committee. I have worked as a disability advocate at Disability Rights California and other legal services programs before I retired about 2 years ago. And I've had the pleasure of being a member of this committee really since then. So lots of good work happening here. And I'm just going to go through the little tiles. And Barbara, welcome. I think you are our newest member, and we're glad to have you. So you want to introduce yourself?
Thank you, Catherine. Yes, Barbara McClendon. I am the Public Policy Director with Alzheimer's Los Angeles. And I've been attending these meetings for probably at least about 6 years now, and am thrilled to be here today as an official member. Thank you.
Welcome. Todd.
Good morning, everybody. Todd Shutter. I'm the Chief Operating Officer and partner of Active Care Living. We're a memory care provider based in San Diego, California. We have 8 communities between San Diego County and Orange County. And I'm proud to announce this morning, over the last couple of months, we've been working on a pilot project with the San Diego Regional Center. And we have 3 residents living in our memory care RCFEs in San Diego County that have developmental and intellectual disabilities and dementia. So we're kind of launching a new pilot project with the San Diego Regional Center, and it's going well, and looking forward to having more residents live in our communities.
That's terrific. And we're going to talk in a bit about, there was a request that we talk specifically about the interface of people with Down syndrome and other intellectual and developmental disabilities and dementia. Dr. Mobley had raised that. So at our next meeting, we're planning to put together a panel. So you will be invited to join us and talk about the work that you've been doing. So that's terrific.
Great, thank you. Let me just quickly announce that couldn't have happened without Molly Nocon and Noah's Home's help. So they're part of our partnership, and I know Molly will be part of that conversation as well. So
terrific.
Thanks.
Thank you. Derek, our Vice Chair, Derek Lamb.
Good morning, everyone. Derek Lamb. I represent my family. My mom just passed away in April with Alzheimer's and vascular dementia. And so that's my personal story. Professional side, I'm the president and CEO of ACC Senior Services based in Sacramento, California. We provide both senior living and home and community-based services. And one of the service category is a memory care for people with dementia. So welcome, everyone.
Thank you. Wynn.
Sorry, it took a while. Wynn Canio, I'm a mental health representative of this committee, also a member of the Alzheimer's Prevention and Preparedness Task Force and Clinical Advisory Board for the Dementia Care Aware. I'm a psychiatrist and geriatrician in Marin, Sonoma, taking care of a lot of people with this condition.
Nice to see you again. Dr. Mobley.
Yeah, hello, everybody. Glad to be here in this meeting to see so many engaged and active people. Really have a very strong interest in the topic in a general way. I'm a professor of neurosciences at UCSD, University of California, San Diego. My lab studies Alzheimer's disease, especially as it relates to folks with Down syndrome, and I'm very eager to make sure that we, the research community, are intimately involved in the work of the committee.
Terrific. Thank you. Welcome. Meg.
Hi, everyone. Meg Barron with the Alzheimer's Association. I'm based here in Los Angeles, but I oversee Central and Southern California. And I think many of you know my counterpart, Elizabeth Edgerly, up in NorCal. So good to see everybody.
Welcome. Andrea, welcome. Do you want to introduce yourself?
Sorry. Good morning. My name is Andrea Robert, and I was diagnosed with mild cognitive impairment due to traumatic brain injury and other condition that's not related to brain changes. I'm mostly challenged with word finding, articulating sometime what I want to say to others, and retaining information. I also worked as a CNA off and on for decades, 3 decades in home health, memory care, assisted living, and hospice care. So I'm glad to be here.
Welcome. We're always glad to have you. Thank you. Sarah.
Hi, my name is Sarah Farias, and I direct our California-funded Alzheimer's Disease Center at UC Davis in Sacramento. I'm a professor in the Department of Neurology at UC Davis, and I do both research and see patients. My research really relates to early detection and behavioral interventions to delay onset and keep people independent. And I see patients as well. I'm a neuropsychologist by training. And unfortunately, I have in my family been touched by Alzheimer's disease. My grandmother suffered from it, and currently my aunt has it as well. So it's definitely near and dear to my heart in many ways.
Welcome. Glad to have you. Celine.
Hi, I'm Celine Regal, Executive Director at Collaborative Care here in Napa, California. And we've been the Alzheimer Daycare Resource Center representative, and we've been in ADCRC since 1999. We have adult day health, we have hospice, we have a palliative care program. We're opening up a PACE program in January where I'll be the site manager. We have a village, and we're the information and assistance provider for older adults in Napa County. And I am a social worker and a speech pathologist by training, and very excited to be on this committee. Thank you.
Nice to have you. Susan, do you want to introduce yourself and maybe your team that's here?
Absolutely. Good morning. Good morning, everybody. I'm Susan Demouris, the director of the California Department of Aging. And today I am thrilled to be joined by Michelle Johnston, who joined the department last month. She is our first Alzheimer's disease specialist in many, many decades. And she was brought on to lead the Cal Compass project that you'll be hearing more about later today. Michelle joins us. She has a public health background, and she joins us from the Alzheimer's Association, Northern California. So she's a subject matter expert, advocate, and fabulous resource to the CDA team and to all of you. So you'll be working with Michelle going forward. She'll be helping to staff and support the Alzheimer's Advisory Committee.
And we have already put her to good use. So thank you very much, Michelle, for everything you've done in a short time to help us get ready for this meeting.
Sure. Delighted to be here. We also have Megan and Kim representing our communications team, and they're helping us with the logistics today. And we're very appreciative of especially the troubleshooting at the start of the meeting. So thank you.
And Sarah, do you want to introduce yourself?
And Sarah.
Oh, yes. Hello. Hi, everyone. Sarah Steenelson, Deputy Director. I'll be on video in just a moment. I am with the Division of Aging Policy, Research, and Equity, and it's wonderful to be here.
Fabulous. Glad to have you always, Sarah. Thanks so much. All right. I think we have introduced everyone unless I've missed someone. So if I have missed you, please take a moment to introduce yourself. Okay, I think we're good. The last thing I'm going to do before we get started with all the exciting items on the agenda is just ask that we approve the June meeting minutes. Those were sent to you. Earlier as part of the packet. So may I have a motion to approve the minutes?
This is Derek. I so move.
And is there a second?
I'll second it. Todd?
Thank you. All in favor, say aye.
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 Any opposition? Any abstentions? Okay, the minutes are approved. So we have done our official action item of the day. And I am going to now turn it over to Susan, who is going to lead us off on the progress with the Alzheimer's Task Force report and the 10 recommendations. So Susan, take it away.
Thank you, Catherine. And I'm really excited to share with all of you. And I think somebody's going to help put the presentation up. And if that doesn't work, I can do it. Kim McCoy-Wade, the governor's senior advisor on aging, disability, and Alzheimer's, had hoped to join us today, but as you all well know, we're in the grips of a extreme heat event, and we have wildfires around the state. So Kim was not able to join us. She had hoped, but she and I did work on this presentation together to showcase for all of you. We thought this would be a good juncture to with the governor's Alzheimer's Prevention and Preparedness Task Force report, much of that was folded into the Master Plan for Aging and assigned officially to this advisory committee to steward and steer these recommendations. So we wanted to make sure that everyone, as we welcome new members, Barbara, special welcome to you. It's great to have you officially on the committee. To make sure that everybody has the same baseline understanding of the task force report and where we stand today with the many recommendations. So I hope that all of you have seen the official report, and we'll drop it into the chat if you haven't. But the task force laid out 10 bold ideas and goals for the state of California. And Dr. Kania was a member, I think the only member that crosses over. So a special thanks to you, Wen, for your contributions to this report. So we're going to walk through the 10 bold goals, and we can go ahead and move to the next slide. And just to give you, to touch on a little bit of detail behind each of these. So in the time since the report was issued in November of 2020, we have seen targeted investments focused exclusively on Alzheimer's, dementia, and caregiving, well over $140 million. We've also seen broad expansions to Medi-Cal and Medicare innovation in our state that touch on individuals with Alzheimer's, dementia, and their family caregivers. And we're especially proud of the comprehensive workforce investments that are just now taking hold throughout the state that equal about $2.5 billion for the full array from home care to specialty geriatrics and neurology. Go ahead to the next slide then. So the first goal is leadership in the statewide task force report, and we'll go ahead and move to the next slide. And in this goal, the recommendation had been for, at the time, it was an Alzheimer's czar, and it matched up well with a recommendation in the master plan for a senior advisor. And so we're so fortunate in our state that we now have, as of a year ago, just about a year ago, Kim McCoy-Wade was appointed to serve as our state's first senior advisor on aging, disability, and Alzheimer's. And she is working closely with the governor and the governor's office on this issue and topic. We also have Secretary Galley, Dr. Mark Galley, who leads the Health and Human Services Agency. And for those who don't know, this advisory committee is considered the Secretary's Advisory Committee. So we are housed in the Health and Human Services Agency with Dr. Galley as our primary leader. Next slide. The second goal was research, and we have researchers here, Dr. Mobley and Dr. Farias and others. So we'll go into some of the detail of what's happening in the research space on the next slide. So we've seen in the short time since the Alzheimer's Task Force report was issued, $37 million in Alzheimer's disease research. You'll see that the most recent round of funding happened just last July of this year. 8.7 million focused on women, communities of color, and underrepresented populations, including LGBTQ. The year prior, we had $7.6 million awarded on the topics that you see here on the slide. So the requests for research proposals had to be in these buckets: caregiving, prevention, early detection, long-term services and supports, and health disparities. And then the year prior, 21 million was awarded in a series of 5-year research grants that are all underway now. And then for those who don't know, California has long had a voluntary tax checkoff for Alzheimer's disease research. This goes back to the 1980s, and it has been continually funded. It has hit its threshold every year. And that brings in the most recent year, it brought in $657,000. So that's steadily in the, in about that range. And that also funds research in addition to these general fund contributions you see above. We'll go ahead and move to goal 3, which is awareness. And we can skip to the next slide. So there's a lot happening in this space. The first is just, I think, a week or two ago, the Department of Public Health issued its, they are soliciting a proposal to do a statewide multilingual public awareness campaign focused on risk reduction. So that's active and open right now, and we expect qualified applicants to submit their proposals and to have something up and running soon after the first of the year. You also may know about the 6 Healthy Brain Initiative counties. 3 of the 6 used their state funding to do public awareness campaigns locally, and all of them emphasized language access and cultural competence. We're thrilled that in the governor's budget and approved by the legislature, there was just an additional $10 million to go to the Healthy Brain Initiative to keep that moving forward. And then last, the Department of Aging, in partnership with other departments, we've received funding through the state's COVID-19 response to promote vaccines, boosters, and through those communications, we've done postcards to targeted zip codes. Over 1 million households received postcards that had information on how they can access resources, including the Alzheimer's Association's 24/7 helpline. And we also did an insert in all major newspapers in the month of July, an aging and disability insert that also included resources on Alzheimer's, family caregiving, and more. Next slide. Portal. So we'll talk here about this is really exciting, and we'll see in the next slide that the Department of Aging is leading in this area. You may have heard of our aspiration in California to have a no wrong door system that bridges our 33 area agencies on aging, our expanding number of aging and disability resource connections, our caregiver resource centers, and all of the community-based organizations, Alzheimer's organizations, and caregiving organizations, and others to have a portal. We're in phase 2 of a multi-year massive IT endeavor at the Department of Aging to build this statewide portal that will include a standard intake, common referral to local service providers, a 24/7 contact center, and key also will be some shared marketing and branding so that the public knows where to go for information and resources to get started. That was a key theme of both the Alzheimer's Task Force report, but also the Master Plan for Aging to really assist with navigation. And we know people don't know where to begin and where to go for help. And our goal is to make that more available so people can start earlier on their journey. We received $5 million in the budget to get that underway, and we're also using some of our federal American Rescue Act dollars there. And we'll go to goal 5, sorry, savings. This is one that you'll see on the next slide. We're making some inroads here, but it's commonly known that Alzheimer's is the most expensive disease in America. So the extensive out-of-pocket costs that individuals and families incur. We're thrilled that just, I think last week it was, the governor signed SB 1126, which expands the Cow Savers program now down to employers with just 1 employee. So now we're going to have more employers participating, and we're seeing a steady increase of individuals who are contributing through Cow Savers. We had a reduction and ultimate elimination of the Medi-Cal asset test, which is really going to benefit individuals and families with Alzheimer's. We're on track for 2025 to significantly reduce the Medi-Cal share of cost. And in this budget, the legislature and governor recommitted to the long-term services and support study to examine a universal benefit in our state. And that's a project that the Department of Aging is leading. We're excited to get started on that this winter. Next slide. Goal number 6, workforce. This is a big one for this committee. And we're pleased to see the approval last year and this year combined investments by the governor and legislature of $2.5 billion. Something that I'm especially happy to see is that it's a very comprehensive approach that spans the entire care continuum. In the case of Alzheimer's, the needs are varied from very light assistance in the home to specialty medical care in hospitals and everything in between. So these are all of the job types that are included in this $2.5 billion of funding. And they're at varied stages of development. Some of the funding happened in last year's budget, so those initiatives are further along, such as the IHSS Career Pathways is up and running. And then some of the others just happened with the July 1 budget, such as the social worker investments are just now getting advertised. So you'll be hearing more about all of this. And the next slide. Caregiving. This goal 7 focuses on family caregiving, and we'll talk here about on the next slide about what's happening in this space. A series of investments that have, when we go to the next slide, so they're a combination of $35.9 million. The first is there's a caregiver certification project underway at the Department of Public Health. The Caregiver Resource Centers, 11 statewide caregiver resource centers that cover the entire state, received an augmentation, and their responsibility was transferred to the Department of Aging. And we're so thrilled to welcome the CRCs into our Aging and Disability Network and to see where we can leverage that asset in partnership with the area agencies on aging. There was a bit of funding in the older adults recovery and resiliency package last year. And then we do receive in our state close to $20 million annually through the Older Americans Act for caregiver supports. Then a few things I also wanted to add. I mentioned that Michelle is leading the Cal Compass grant program. Celine knows a lot about this, and she can be our expert, but we did have a request for proposals out. The deadline has passed, and we have $5 million that will be awarded to adult day healthcare and adult daycare sites around the state to bring back what had formerly been the Alzheimer's Daycare Resource Centers. So we're really excited to review those grants and to make those awards after the first of the year. Another piece that the department is working on is, this name is going to change, but the legislature provided $450,000 to the Department of Aging to convene a work group. We'd love to have representation from this advisory committee to examine visitation in residential care facilities for the elderly, board and care homes, assisted living, skilled nursing, intermediate care facilities during public health emergencies. So we know how difficult it was for residents and families when visitation was not permitted. And so we're going to take this time when we're not in a public health emergency to re-examine some of our policies, procedures, and protocols and bring recommendations forward should this happen again. We also received $50 million to close the digital divide. This is money that is going to all 58 counties. So We'll be looking at devices, training, new technologies to help connect people and combat social isolation. And then for those of you who follow CalAIM, the major Medi-Cal initiative, one of the 14 community supports is respite. So we're really pleased that that is now an available option in some communities, and we hope it will be increasingly available to families. And goal 8, this is like I don't have these memorized, so I'm like, ooh, what's next? Okay, blue zones. So we'll talk here about what's happening in the blue zone space with the next slide. So there was, we were really fortunate to have Dan Buettner, the world-renowned author and leader on the Blue Zones Initiative, as part of the governor's task force. And we received, the Department of Public Health received $1.7 million to explore a Blue Zone initiative in the state. And I believe by October, we'll have some announcements there. So plans are underway. Our state also earned the AARP age-friendly state designation a year ago this summer. That was a goal of the master plan in terms of age-friendly and dementia-friendly planning. In the budget passed by the legislature and approved by the governor in July, the department received $4.5 million to award age-friendly planning grants to local communities. So this will build off of the master plan for aging. This will build off of the Healthy Brain Initiative. It will build off of the AARP age-friendly state designation, and it will build off of the dementia-friendly initiative that is led by Alzheimer's Los Angeles in our state. So we're excited to announce that and up the grant funding towards the end of January next year. And then I mentioned already that we're entering phase 2 of the Healthy Brain Initiative with an additional $10 million investment to continue that outstanding work. And now, goal 9, volunteerism. This was a key piece of the Alzheimer's task force, and we're pleased that in the budget there was $10 million to reinstate 2 very popular programs that were cut during the recession in 2008, the foster grandparent and senior companion programs. We're working closely with Cal Volunteers. We also received $4.5 million to revitalize the long-term care ombudsman volunteer program with targeted recruitment and outreach strategies to rebuild our volunteer ranks in the ombudsman program, and also to make families and residents aware sooner of the services of the long-term care ombudsman, so that they can start engaging with the ombudsman before there is a crisis and they can establish a relationship. And then the final goal, it's a doozy, and many of you here are working on it. Goal 10 is the dementia standard of care. And we'll move to all of the progress happening in that space. We got to hear about Dementia Care Aware. So first of all, at the Department of Public Health, they continue, and Dr. Farias is representing the center there. So they've been working on the Assessing Cognitive Complaints toolkit and disseminating that to community providers. So there was additional funding for that. There was the $25 million for the Dementia Care Aware initiative launched in July and now up and underway. We have a member here who sits on the steering committee, and I know, I believe Meg Barron and Jared Geruso presented a bit on this at our last meeting. I touched on the community supports in CalAIM. There's also enhanced care management, the carve-in of long-term care after the 1st of this year, and the rollout of the dual special need plan. So there's a lot of activity happening in CalAIM. And then we've been working closely with Anastasia Dodson and her team at the new Office of Medicare Innovation and Integration, and they definitely have Alzheimer's and dementia on their radar as they get that new office up and running. I believe that, oh, I think, and wait, there's more. I think we also did a catch-all. So something that, Kim and I and Darcy, the other department directors talk about is, what is Alzheimer's and what is not Alzheimer's? And, in a way, everything could be Alzheimer's. And we really don't want to limit ourselves to just those targeted investments that specify Alzheimer's and dementia. So we wanted to let you know that the Aging and Disability Resource Connections have reached half the state's population in terms of geography. And we have plans to add even more that are emerging ADRC sites. You may know that last year in the budget, we lowered the age for adult protective services to age 60. And this is something that our State Elder and Disability Justice Coordinating Council is focused on, the APS program. And I know that some of your organizations are represented there. We added assisted living waiver and MPSS. I did that wrong. Yeah, sorry about that. We added slots, and the assisted living waiver will soon go statewide. We continue to fund Friendship Line, which is a warm resource available 24/7 for people who are isolated and alone. And we've seen tremendous results from that, and the data that just came in from an evaluation that UCSF is doing is, many of the callers call 8 times a month, and the average length of call is very long. So people are absolutely getting the support they need. It's not a transactional line or a referral line. It's truly a warm line. At our Department of Aging, we've just added our first public guardian liaison, and we'll be recruiting for that position after the first of the year. And it's part of our overall effort to bring together the conservatorship, public guardian, APS, and to really focus on especially unrepresented individuals and people who do not have family members to act on their behalf. We'll be learning more about the nursing home quality initiatives and new rate structure. The Office of the Patient Representative, this was a result of a court case that requires when an individual in a nursing home or intermediate care facility does not have a surrogate decision maker, a family member, or somebody who can make decisions on their behalf, there is now an office of trained specialists who will assist the individual and represent them. And then we did, we've expanded full scope Medi-Cal coverage to all those age 50 and older who are undocumented. That took effect this summer, and we're starting to see those numbers increase as we had hoped. And then the last piece is we continue our stakeholder engagement work. So while the master plan for aging, completed their work, the long-term services and support task force completed their work, the Alzheimer's task force completed their work. The work continues through these 6 stakeholder bodies. You're number 1 when it comes to Alzheimer's, dementia, and family caregiving. You are the home for those issues. We also have the Oversight Committee for the master plan. It's called IMPACT, which stands for the Implementing the Master Plan for Aging in California Together. And one of those members is Dr. Elizabeth Edgerly with the Alzheimer's Association. Our Equity Advisory Committee, Edie Yao has served on that for the last couple of years, bringing an Alzheimer's perspective. The Disability, Aging, and Community Living Advisory Committee. This used to be the state's Olmstead Advisory Committee, and Jared, who's with us today, serves on that. The Elder and Disability Justice Committee, we have an Alzheimer's representative there, and Eric Dowdy. And on the research committee, Dr. Heather Young from UC Davis, who oversees the UC Davis Caregiving Institute and has long been involved in the Betty Irene Moore School of Nursing, brings that geriatric and Alzheimer's expertise to our California Aging and Disability Research partnership. So I think that concludes our slides. Let's see, let's see, is there one more? I think, oh, okay. Yeah, I should have started with this to report out on all of these achievements. If you didn't hear it, the full credit goes to the governor, the administration, and the legislature for making it all possible. And of course, the stakeholders who brought all of the proposals forward. But all of the highlights that I mentioned to you belong to all of these agencies and departments. So when we worked on this slide deck, we really wanted to show you where the work is happening and focus less on who's doing the work, but to let you know it's happening. But these are all of the departments and agencies that are involved in the Alzheimer's, dementia, and family caregiving space. So my thanks to our colleagues across agencies who are doing this work, and I believe that's the end.
So impressive amount of work and forward progress. I just want to thank all of you, Susan, and your team, and everyone else from the secretary and downward that's been involved in the work. And I thought we might take a couple minutes to see if people had questions. And before we turn to that, I want to just acknowledge one of the this committee's priorities had really been on the visitation issues in long-term care facilities and the impact of social isolation during the pandemic. And Susan approached Derek and I about the idea of incorporating this committee's work on that topic into the new committee that's being formed to look at a whole bunch of different kinds of facilities and develop some approaches for visitation now that we're through what seems like the worst of the pandemic. So I think that's really an exciting place for that work to be. Derek was our lead on that. So I know that he will be joining the committee. And as Susan said, if there's other people that are interested, please let Susan know. But it's really nice to have a home for something that was very, I think, personally and professionally important to lots of people on the committee. So we're really grateful for that. That work that you'll be doing. And so other questions for Susan or comments? Barbara, you have your hand raised. Go ahead.
Hi, Susan. Thank you for that really impressive summary of all that's been happening. So I had a specific question about the LTSS study to examine the universal benefit. Can you just help me understand a little more how all the work that's already been done, how this is building on that, and just speak to that topic? Thanks.
Absolutely. And I'm going to invite Sarah Steenelson, who leads our Division of Aging Policy Research and Equity. Sarah's been a lead on that work once we learned that it was approved by the legislature. So Sarah, can you fill Barbara in?
Absolutely. Thank you for the question, Barbara. And really what we want to do is ensure that all of the excellent work that has been done to date, including the LTSS financing study that was done by Milliman in 2019 with the Department of Healthcare Services, as well as the work that's currently underway with the Long-Term Care Insurance Task Force and a tremendous amount of research that they have done. We are going to take all of those findings and identify where there is a need for additional data and research, not just in structuring an LTSS benefit, but also in different options and financing and service delivery. So it's going to be in the form, we have some flexibility to use it for additional data development and research. And we have, I think, about a 3-year time period through which to utilize those funds. So we are definitely intending on, engaging stakeholders throughout the process, and we'll be in touch with more information. So I hope if you have any other questions, please reach out, or just happy to clarify now as well.
Thanks, Sarah.
Thank you. Sarah has a question, and then there's 2 Q&As that I'll read off next and see if there's an answer to those. So go ahead, Sarah.
Yeah, thank you so much for this presentation and the update. I'm just super impressed with all the movement that's taken place. So really great. I did have a question about the workforce investment. And you mentioned that includes increasing social work and mental health. And I was wondering how exactly that's being implemented, and if there is a potential to collaborate with the California Alzheimer's disease centers. A lot of the centers do have social work, probably, well, to some degree, mental health workers, but that would, I think, potentially be a route to implement some of that. Thank you.
You'd be great partners in that. I agree. And I'll be sure to share that. And this might be something we dive deeper into at a future meeting to really unpack the workforce initiatives. But while we're meeting, I'm going to share a link from the something coming up in the social work space. And I can give a lot of credit to Darcy Delgado, who's heading the workforce initiatives for us at the California Health and Human Services Agency. So there are various stages, the social work and nursing investments, community health workers, those happened in the July 1 budget. So they're really just getting off the ground. So there is opportunity to influence and shape that. So we'll make sure that you have, that this committee has all of those opportunities, and we communicate when there are webinars and calls for comment or funding opportunities that are announced.
Thanks, Susan. And I like the idea of being able to have maybe updates in more detail about those, that maybe we could just take a particular part of the workforce investment at each, at subsequent meetings. So that would be great. Dr. Mobley, I'm going to take two of the questions that were raised by people in the audience, and then we'll get to you. Starlet says that that it's great information, and she just wants to know how people can get involved with the visitation guidelines. So there might just be a contact person, Susan, that we could identify to get updates and find out ways that people can provide input into that process.
Great. We're just starting to design that. We're going to work with a consultant, Manat, will help us lead that work. And so I think there will be an official committee formed, but there will also be opportunities for public comments. So we'll put here in our, in the chat, how you can learn more to stay in touch. And I hope everyone follows the Department of Aging. We try to promote all of these webinars and things, but I'll put my email in the chat.
Thanks so much. And the second question was from Lynn about please define what geriatric training refers to. And I think that was from the presentation as well.
So most people are familiar with pediatrics. So pediatricians work with young children, and geriatricians. We have one on this. So maybe Dr. Canio could be a better person to respond to that, but geriatricians work with people later in life. You want to elaborate, Dr. Canio?
Sure. I think to simplify what we do as geriatricians, or anyone that is, specializing, whether they're social workers or pharmacists, is that we, in addition to focusing on the medical conditions that people have, but we also focus on what we call the 5M to simplify it. And what are those? We're always assessing for the mind, which is, detecting, assessing for dementia, depression, delirium, and managing those if we are able to detect those. Medication, as we get older, we take a lot more and more medications, and some of these medications may not be needed anymore, or they interact against each other. So we look at the risks of the medications that we're giving, and balance them with what matters most, which is the third M, with the patient. And then the fourth one is mobility, assessing for mobility, whether they get to, point A to point B, or assessing the risk for falls and modifying those things. And then the fifth is really the multi-complexity, putting everything together, getting the psychosocial aspect of the care addressed. ensuring that whatever medical conditions that people have, from the geriatric perspective, we might be treating that differently. And for instance, if somebody has diabetes, a certain hemoglobin A1C, which is a number that we get to make sure that we have a control of diabetes, may be different for somebody that's 85, especially with dementia. But those are the things that are different in geriatrics, and hopefully, with respective, with your respective, I guess, disciplines, we will tailor the training to hopefully have everybody engage with that.
Thanks so much. Yeah, thank you. Thanks for the addition. Dr. Mobley, you had your hand up for a question.
Yeah, I mean, I'm just extremely impressed at the investment that's been made. I mean, it's really phenomenal. And looking at it, it's pretty clear that there was a definite attempt to integrate across all these different domains, from research to clinical care to educating providers to caring for caregivers. I mean, it's amazing. I mean, I'm not sure that I've ever seen anything that at a statewide level that's more impressive than this. So this really is phenomenal. But with this comes an enormous responsibility to coordinate and I would argue more than just coordinate and measure impact. So is there, and maybe this is for Susan, but is there so what's the point of coordination? Is this the governor's office? Is this the office of the senior advisor that coordinates these things? And to what extent is there a plan within each of these programs, or most of them, let's say, to measure impact of investment?
That is such an outstanding question. And so yes, the court, it's our great fortune that we do have a senior advisor now in the governor's office who really is not, who has the vantage point for coordination purposes of looking not just at the Health and Human Services Agency, but what's happening in the housing agency and the labor agency and other places. So that's helping with coordination at the macro level, definitely having Kim McCoy-Wade in that role. And then in each agency, I can tell you in the Health and Human Services Agency, there are a number of, we coordinate formally, informally, regularly, periodically, across directors, across staff, and Secretary Galley, he's known for being a silo buster. So he really encourages us to collaborate and coordinate across, within the department. When it comes to Alzheimer's and dementia and caregiving, there's not one, it is a good thing that it's not in one place for the people who live with Alzheimer's and dementia. But it does make it a challenge. Certainly a lot is happening with the Department of Healthcare Services in the Medi-Cal program, but not everybody is a Medi-Cal beneficiary. So we will always be coordinating and collaborating across departments. And in terms of evaluation, much of this money is one-time funding with a limit, whether it's the federal funding or the state funding. And so there are dollars built in for evaluation. As you know, that usually comes at the end of the initiative or the demonstration or the pilot. So, it will be a few years before, before we hear the results of some of these evaluations. And there are a number of pilots and demonstrations that are just getting started, and we won't know, the results of those for some time.
I mean, that's encouraging. Both the coordination aspect and the impact finding aspect are important. My sense is that in the middle of these projects, there's always a better idea that comes along. There's a new thought. So it would be very, I think, useful to measure at intervals, relatively smaller intervals, even if only superficially or only sort of at a kind of high level, to make sure that what the investment is the best investment one could make. and to modify that when it seems to be maybe going in a different direction would make sense. So it's a massive thing, Susan. I can't imagine one person possibly encompassing all this in their brain, but just the commitment to coordination and to measuring impact and to being flexible, it seems to me, it would be very important.
Mm-hmm. Thanks for the comment and the response. There is a lot going on, and I think we all want to understand what the outcomes of that, all the investments will be, and understand how it works across agencies. And I think any of the specific initiatives that Susan's identified today that we want to take up and hear a bit more about as a committee, maybe drop that into the chat and we can work that into the agenda, like throughout the next year, just as a way of getting some more information and understanding in more concrete ways how it's being coordinated or how outcomes are being looked at. So if you have a favorite initiative or two, please feel free to let us know. I think it's really an amazing time, I think, to be on this advisory committee where there's so much work happening and so many investments, and really learning about those in more detail will be helpful, I think, to us as we go along. We want to be responsive to what everybody on the committee wants. Barbara has already flagged workforce, which we talked about briefly before about that. And we're going to be talking some about workforce in our next agenda item. And one of the things I'm interested in is what we're suggesting, kind of, advancing what's already underway and getting some feedback, not only from members of the committee, but from the staff that are working on some of those workforce initiatives. So in just a minute, we'll turn to those topics as well. Okay, are there other questions on this agenda item? Okay, not seeing any, we're going to turn to our next agenda item, which is doing the work we need to do today to get ready for the event that's happening on September 20th, which is the California for All Ages and Abilities Action Day. And the intention of that is to really help the state shape where to go next with the master plan for aging, and I say and disability, because we're sort of at the place it's been implemented well, I think, but it's now time to prioritize what should we be doing next and what new strategies might we be considering. So each committee has been asked to come up with 3 recommendations that will be presented to the full convening, and then the state will use that information to help identify what the priorities are for the next couple of years. I think all of you should have received an invitation to attend the event. You can attend in person in Sacramento. I think there's also a virtual option that's available. And Susan, do you want to provide any other background that I might have either said wrong or overlooked?
No, but I think, the live stream option is open too. So anyone who can't join in person, we have over 800 people that have signed up for a combination of in-person and live stream. And we've firmed up, we'll have secretaries, cabinet secretaries, a message from the governor. We'll have legislators and legislative staff, stakeholders. So it's a packed day, and it's definitely worth your time, in my view.
It's going to be great. So at our last meeting in June, Amanda provided some basic information about the convening, and we decided that we didn't really have time to flesh out recommendations in June. And so we convened a small work group that I was on, and Derek Lamb, and then Win I keep saying Canio, but I've now learned that is not how you pronounce your last name. So my apologies. Canio, is that right?
You got it.
I got it. Okay. And Meg Barron. So what we want to do now is walk through those recommendations. I think there's some slides that have sort of the summary of it, and I think you all got copies of the actual recommendations sent to you. Big shout out to Derek, who took a lot of time to help get these off to the Department of Aging and has done some work on getting our slides in order for the event on the 20th. So I'm really grateful for his leadership and willingness to help with that. So, and Michelle's just put into the chat where you can find the draft recommendations. So I think with that, what we're going to do is walk through each of the recommendations. Wynn and I were working on recommendation number 1. Derek has recommendation number 2, and Meg Barron has recommendation number 3. So I think what we'll do is walk through each of the recommendations, hear from you about any questions, comments that you have about those after each recommendation, and then just lead with follow up at the end with any final comments. So make sense? Okay, so we are gonna start with recommendation number 1, which is the one that training and career pathways for direct care and healthcare staff that Wynn and I worked on. And I think there should be some other slides, Michelle, right? A slide about that one. So do you want to, Wynn and I did not talk about these slides before, so we're going to kind of share these on the fly. But do you want to lead off with sort of what the overarching idea is for the healthcare providers, Wynn? Would that be good? For the part that you worked on?
Sure. Would you like me to do that now?
That'd be great.
Okay, sorry.
No. That's perfect.
I think there is a recognition that all of us in healthcare should be aware of symptoms of dementia and ways to take care of people with dementia. I think engaging everyone, just not even the physicians, which I think the Dementia Care Aware was targeting, but everybody from scheduling to nurses to social work to know how do you take care of somebody with dementia when they go to your office or they call you. There might be communication strategies that might be more helpful. When do we engage a caregiver to hopefully help implement a better a plan of care for that individual who may not remember the care plan that was shared with them. So those are the kind of things that we hope that we will be able to provide. So it's sort of like our Dementia Care Aware 2.0, I would say, or at least we're hoping that we could implement at some point. Is that good? Or
that's good. Thank you. The second part of this, because this is all about training and career pathways, is for looking for opportunities to expand career pathways for direct care staff, including the feasibility of tying training to wage increases so that you would have essentially a career ladder that people would be able to follow and have their wages increased as they went through that. Also then expanding opportunities at community colleges for certification programs for direct care staff. What we know about direct care staff is they are often low wage workers. They're also from very diverse communities, often Black and Brown individuals that are providing direct care staff, and that they have often very little opportunity for advancement. So the goal is to increase both the training they get and the opportunity to use higher wages. And I think both of these initiatives are designed to, in the end, provide better care, as Wynn said, for individuals with dementia, because when you have a better knowledge base and understand better how to interact with people or specific skills, you're going to be able to provide better services to this diverse group of individuals. So you'll see here the kind of suggested steps. Wynn talked about expand dementia care aware training for all care providers, training and certification programs for direct care staff, look at the feasibility of enhanced training for tying it to wage differential, for trained staff, and then pilot certification programs with community colleges. And I think anything else you want to say, Wynn, about our initiative? There might be one more slide. I don't remember this. Oh, advancing equity, which we just talked about. So let's stop there and see if you have questions about recommendation number 1.
This is Todd. Just a quick comment that I think it's important to kind of take a look at the work that
DDS
California,
is doing.
well, DDS, but also the California Assisted Living Association's work for the last 8 or 10 years with Department of Social Services to require dementia training as part of the mandated training for all of our caregivers. So there's a minimum of 10 hours that are already required for any caregiver working in an RCFE in California. And so that's a good fundamental start. And that's across all communities, whether you are a special dementia care, memory care community or not. So there may be ways to kind of piggyback off some of that work that's already been done and look at those standards.
Terrific. Thanks for that. Barbara.
Just a clarification question. Are you focused on direct care staff in facilities like nursing homes? Is that the...
I mean, it could be direct care. I just view it as all direct care staff personally. Like, I know there's some work being done with IHSS.
Exactly.
Our staff in nursing homes. There's also direct care staff that go into people's, homes that would be like a home health aide that are providing some direct care. So I use the term direct care staff to be broader than just one place.
Maybe then when this is presented at the big meeting in a couple of weeks, we would just want all of these people coming to know that we are aware of all, like, that there are career pathways that have been developed for IHSS workers, and there are wage increases that are tied to, if you go to some of this additional training, and some of the specific modules are about dementia care. And so maybe acknowledging all of that and some sort of comment about how you want to
build upon that.
Build upon this very robust workforce development work being done around IHSS workers. And then to Todd's point too, that, we know that there are training requirements that are in these other settings as well. So you would need some sort of comprehensive view of what's required where and what we can build on. So I just wouldn't want anyone, if our committee is presenting this, for somebody to start reading that in their brain to immediately think, we already have career pathways, right? Because it's thinking about what's been done at IHSS. And so we would want to be making that larger point that we want to build on that.
Okay, good suggestion. Dr. Mobley?
Yeah, hi. Just I love the idea. It makes perfect sense to me. The challenge that I see at a very practical level, and this is partly in the context of the dementia care aware work, the discussions that we're having, is that getting people to train is not simple. They really have to understand what the benefits are. And in the case of physicians, for example, or office staff, the training has to be seen as a real positive. It's something that really works for them. It's really a rewarding experience. And to some extent, it's got to be made easy. I mean, these people are so overwhelmed. I mean, they literally are overwhelmed. They're having trouble even thinking about how would I administer a screening test for dementia and not, run over my allotted number of minutes per patient. So something about making it really inviting and easy and non-painful to actually seek this training. I don't know how that works out, but I think this recommendation is very powerful. It's really needed. It's going to be more needed as more and more people, as we develop therapies for Alzheimer's disease, this is going to be even more important, because they're not only going to have to know how to sort of speak with people and evaluate people, they're going to have to learn how therapies are being properly implemented in this patient population. So I love the idea, but I think being practical about how it works so that it's seen as a big positive something to do, something that's made easy to do would be important.
Thank you for bringing that up, Dr. Mobley. And I think we want to point out that it's a lot of the times in clinic visits or ER visits, or even in the hospital, it is more challenging to care for somebody with dementia. And so hopefully with the tools that we will provide, that will make it much easier for them, right, to be able to do what they need to do. And at the same time, hopefully provide better quality care, because now they know when and how to do that. Thank you.
So, Celine.
Yeah, just kind of backing up on what Barbara was saying, I think that's because there's so much cross-pollination going on with all of these, initiatives, and we can use words like settings, or we can use words like providers in this really broad way that people don't see themselves in that. And so just, for instance, we are going to be an ECM provider as a CBAS provider for managed care, but they didn't see us as a provider that potentially could provide that service. So I think in defining who providers are, so that we're really showing how this is all working, our goal is to make this work across settings. So people, see themselves as all providers, community-based versus, like dementia care aware, because I know like in the Cal Compass, like taking that work and like, well, how does that apply to a CBAS center? So just being able to dial it down a little bit to all levels.
Good suggestion. Thank you. Andrea.
Hello. I love what you guys are doing, Catherine. I totally agree with Dr. Mosley that a lot of time there are people of people Black and Brown community that work in these positions are paid very low. A lot of time they're working multiple jobs, and I'm also speaking from experience. And when you're working multiple jobs, a lot of the IHS workers they're working multiple clients, and sometimes it's really hard to add in training. But if training is necessary, it has to be appealing. And I know from personal experience, if I had the opportunity to go from CNA to maybe LVN to RN, that is more appealing to me than to continue to get training on low wage certifications. One example is that I went from a CNA to a CNA/med tech. I went from $10 an hour to $18 an hour. So I think that the certification should be fair, considering already that these workers are already working at low wages. And because of the workload, it is not always necessary. It's not always feasible to continue to get additional trainings. I mean, a lot of these trainings can be done online, but a lot of time the training continue to perpetuate low wage jobs. So I love the idea of some type of career pathway in the event that the person have the time to be able to segue into a better position where they're getting better wages. It definitely has to be appealing. And again, the training is very good, but this group of individuals and this population that's already providing, caregiving, they're working at low wages and they're burnt out. They're really, really tired. And again, I'm talking from experience. So I'm glad for this initiative, and I would love to see it built upon even more.
Yeah, thanks for the reminder about the importance of framing it about career pathways so that people see the opportunity that may be available. So I think that's a helpful reminder. Thank you for that. Any other comments from panel members? I think there's one. I think I'm just going to read the other comment. I'm suggesting attempting to coordinate caregiver career pathways with the eventual benefit of having that same kind of care given to them when they're older or if they're in sudden need. For example, a caregiver in an assisted living center or a home health care aide ought to be able to afford or be benefited living at that care given to them by others if needed. The wages have been so low, it seems most could not afford the quality care that they've given to others. So I think that's the realization of the impact of low wage jobs, that people then don't have the resources to get the care they need. I think that ties nicely to some of the work that Susan was talking about earlier about expansions in Medi-Cal to provide other kinds of benefits like respite and other kinds of services, and reducing some of the asset and other kinds of tests. So good point on that. Okay, any other comments or feedback about recommendation number 1? Susan, did you have any comments? No, okay. All right, I think Derek, you're going to lead us through recommendation number 2.
Thank you, Catherine. And just want to point out, Catherine and Wayne really spearheaded these recommendations from a small group, and so we were able to present this to CDA and include it with a discussion today. So I just want to point out that is close and dear to my heart about the impact of loneliness and social isolation from kind of 2 fronts. Number one is personally, I witnessed during the COVID, pandemic, how much loneliness and social isolation have caused my mom to deteriorate very rapidly. From going to an Alzheimer's Day program 5 days a week, and then to 3 days, and then eventually to not going at all after there's declaration of social isolation. But also, if you look at research, according to the Centers for Disease Control and Prevention, they quoted a study by the National Academies of Sciences, Engineering, and Medicine, saying that social isolation was associated with about a 50% increased risk of dementia and other serious medical conditions. And there's a strong evidence that many adults aged 50 and older are socially isolated or lonely in ways that put their health at risk. And immigrant and lesbian, gay, bisexual populations experience loneliness more than other groups. And then Latino immigrants, for example, have fewer social ties and lower levels of social integration than US-born Latinos. And then first-generation immigrants experience stressors that can increase their social isolation, such as a language barrier, and that's the focus of this recommendation. Differences in the community, family dynamics, and new relationships that lack a depth or history, the report states. Similarly, gay, lesbian, and bisexual populations tend to have more loneliness than their heterosexual peers because of stigma, discrimination, and barriers to care. So with that kind of framework, I put together this recommendation as a continuation to expand culturally and linguistically competent communications to older adults, people with disabilities, and families. Actually, this is an existing recommendation in the Master Plan for Aging. And with that, it will reduce barriers that cause social isolation, especially for those who are non-English speaking or limited English speaking who are new immigrants to the US, as what I mentioned based on the introduction. Next slide, please. So the steps I suggested will be to prioritize using bilingual and bicultural translators to create communications. A lot of times we see translation that are so official that it's really hard to understand by the lay people, especially those who actually come to the US recently. And also, not to mention, a lot of times translators might use online platform to do translation. And literally, it's very hard for people to understand. I can attest to that because I have been involved in Sacramento County, the mental health Stop the Stigma program, and so say for example, the translation came to my attention, was in a draft form, and a lot of times I have to spend hours just to make sure that the Chinese translations are really appropriate for the Chinese community, whether they are Cantonese speaking or Mandarin speaking. So the second suggested step would be to work with local community-based organizations. Again, those really are the linkages to lots of ethnic communities. And so it's very important to utilize them instead of just, using professionals or just using, the online platform to do translation. And then more importantly is to create inventory of culturally and linguistically competent materials, and to look at, the translators, whether we have, any registry, to make sure that during the time we need any translation, we already have the resources that we can reach out instead of just scrambling for the right individual to help. Next slide, please. In the space of advancing equity, by doing so, we hope that this will ensure that older adults, people with disabilities, and those who are non-limited English speaking will have access to resources. And most importantly is to reduce social isolation and loneliness, which will cause severe medical problems among those who are being affected. So that's conclude the recommendation, and I'm open to have any feedback from this group. Dolores.
Okay, yeah, thanks, Derek. That is very clearly stated and so thorough. I would just like to add a couple of thoughts. One is that many times when translation is done, as I know the wording isn't really, it's a literal translation is done instead of a conceptual translation, so that the concept that's trying to be brought across might not come out clearly because the words are not appropriate. So I would, if you wish to add that idea of a conceptual rather than literal translation of materials, that could be helpful to others looking at these slides who may not be as familiar with that. The second thing I wanted to say is that building trust with community organizations, again, is something you know very well is so important to the whole success of this. So I wonder if that might be, when you're talking about community organizations, I think it was the previous slide, to recommend, to have that even as a recommendation, that it be a message, that you need to spend the time and effort to build that trust, which I think maybe is perhaps a bit more of a call to action than collaborating or working with, but it would be very specific, build trust, and that will help a lot in disseminating, in creating information and disseminating it, I think.
Absolutely, Dolores, thank you so much for your feedback. Just want to share with everyone in the meeting that Dolores and I actually have gone way back, and actually we have worked together to make sure that we will find meaningful ways to deal with ethnic minority populations, especially in the space of dementia. So your points are well taken. Thank you so much, Dolores. Anyone else? Back to you, Catherine.
Okay, perfect. I think we're going to take up initiative number 3, and Meg Barron is going to present that for us.
Thanks.
A recommendation.
Thanks,
of number 3.
Catherine. Thank you so much. And I'm going to be focusing on unpaid and family caregiver support. And we have a multi-prong approach here. And the first one is to provide financial support. The second is offering training. And the third is increasing investment in and access to respite care. So I don't know if you want me to go into how this connects with the MPA initiative or not, Catherine, but I can move on to just diving into each one of these areas.
Yeah, I think that would be great. Just talk about each one of the areas. That'd be terrific.
Perfect. Okay, so is it on the next slide that we go into each one? Good. For financial support for unpaid caregivers through vehicles such as tax credits or long-term services and support benefits is in making it easy to understand and accessible. Building on increasing access and awareness to state-developed dementia-specific training for unpaid caregivers, as well as expansion of Alzheimer's daycare resource centers. with a focus on disproportionately impacted communities of color. And then the last is increased investment in respite services for family caregivers, such as Caregiver Resource Center, focused on providing these services to communities of color. And I dive a little bit deeper and looking at the CDPH report, concluding that out-of-pocket expenses for unpaid caregivers and the Black, Latinx, and AAPI communities are at higher than the state average. So looking at affordability and making sure that any educational programs that are designed by the state are in multiple languages. And then on to the next slide. Is that it? Advancing equality, which I went into early, obviously. And I think this one is probably, in my opinion, one of the easiest to understand. Maybe I'm wrong, and I just love this recommendation, but it's really just focusing on, again, on making sure that we're making it more affordable with a focus on disproportionately affected communities, making sure that we're focusing on our education for unpaid caregivers, again, in multiple languages, and then looking at respite care, which again, making it accessible to multiple communities. So.
Thanks, Meg. Let's see if anyone has any comments about this one. And it looks like Barbara does.
A question?
A question. Perfect.
Yeah. Can we go back to the previous slide?
And before you start, Barbara, I didn't also add that Jared did work with me on developing this, and I should thank Jared for helping me with that. So sorry about that. Sorry, Barbara.
Yeah, no worries. Wondering why it says increased access to and awareness of state-developed training instead of something like increased access to and awareness of evidence-derived trainings. Because I'm just, I know we all know here, there are many family caregiver trainings that have been developed, some of them by community-based organizations that are specific to different diverse communities, so very culturally, linguistically appropriate. So is there a reason that you, because if including that language about state developed really narrows down the kinds of family caregiver trainings that you would be, we'd be saying should be promoted and access should expand to?
Absolutely, good question. And I put state because I recommended that the state oversee the development of the program. And add anything on that as well?
Was that to me?
Yes, Jared, sorry.
Yeah, I mean, really, it's just because the orientation of all of these goals is around the master plan for aging and what the state should be doing. I hear what you're saying, Barbara, but I think it's more with respect to the fact that we're urging kind of the state, the administration, legislators to invest and help develop these trainings. Not that they're the ones designing them, so to speak, all the time, but that, this is more geared towards the master plan for aging. So that was
I think that language could be misinterpreted, that we think the state should design trainings. And I would hate to have state resources go to recreating something that may be quite well done and already out there. I do think some kind of language about awareness to evidence derived trainings would be important, though, because you don't want all trainings are not equal. And you definitely want family caregivers to have access to quality trainings. But yeah, exactly. Dolores is putting this in the chat about Family Caregiver Alliance trainings. There are some excellent trainings. And so I also get your point about wanting to pull the state into this and make sure that they are engaged on this issue and maybe providing some oversight. I just think that language about state developed is a little problematic.
Okay. We can look at that. I think that's good. That's good advice.
Yeah, I think just a quick suggestion. I agree with Barbara. We use as a private pay provider a lot of resources from the Alzheimer's Association, from Southern Caregiver Resource Center, from UCSD, And so maybe something more inclusive like state approved training or, state endorsed, something that broadens that up and makes it a little bit more inclusive.
Agreed, Todd. Thank you.
Other comments?
Could I just, I'm sorry, but even state approved could be problematic because like, is there a process for approving? Like you say that, is that CDPH that now has to have a process for approving trained? Because I don't think that exists already. So not saying we wouldn't want to include that language, but maybe just think that through a little bit about, because we wouldn't want to do anything that would actually be a barrier to accessing quality trainings.
So I think the concepts are that you would like this group to look at changing it to quality training, and that we should look for ways for state engagement, but it might not be in the development or approval of it. And I think the next step, and it's going to happen really quickly, is each of the three groups that worked on these. So Wynn and I will take the feedback and figure out how best to incorporate the feedback by tomorrow morning, as will Derek and as will Meg and Jared, so that we can kind of get these in final shape. They have to be submitted online, I think, by tomorrow, and there's some slides that Derek's done that might have to be tweaked slightly. So really appreciate the feedback. I think what we're looking for is just sort of with this feedback, the general sense that these are headed in the right direction and the committee's comfortable with us presenting these that incorporate the feedback. Does that make sense to people? Yep. Okay, sounds good. So what I'm going to suggest is we need to take a break. I want to do two just brief announcements. One is that we're really thrilled that Kim McCoy-Wade has joined for part of our meeting. I see her down there, so welcome. Thank you for joining us. We know you're really busy with 100 other things. And I also want to go ahead, please say something. Yep, go ahead.
Only busy with heat. That's the only thing that would keep me from this terrific discussion. So thank you so much for understanding, and I hope everyone's staying cool. This has just been enormously inspiring and interesting to listen to. So thank you, Catherine, for all the work that went in to have this conversation. It's just amazing. So thank you.
Great group of people on this committee, that's for sure. And I also wanted to just remind people that Dr. Diane Ramos was just appointed as California's new Surgeon General, which is really a terrific appointment, and she's done so much to help advance Alzheimer's through both her involvement at CDPH, but also on the Alzheimer's task force. So it's just another example of the attention I think the state is paying to something that we're all passionate about, and having a friend in that position is really wonderful. So thanks, Susan, for the reminder of that, and making sure that all of us knew that. And I, in the introductions, forgot to let Jared introduce himself, but he's going to be doing legislative updates. So we'll let him do that then. And as soon as we get back, I thought we would just give anyone from the public an opportunity to comment on the recommendations that we're making, just so we hear public comment about that. And then we'll return to the rest of our agenda. So it is, why don't we try and be back at, not the best, let's see, it's a 40, by 11:55 would be about 15 minutes. So if we can do that, and we'll take a little public comment on the recommendations. So thanks everyone, and enjoy stretching a little bit. So I think as we're just reassembling, let's just start opening it up for public comment. So if there is anyone from the public who wishes to provide a comment, this is just about the recommendations that we'll be presenting at the California for All convening next week or the week after, I guess. We would welcome your comments. And do they do their hand? Is that they just let you know, Michelle, by raising their hand? Is that the strategy?
Yeah, Camera Megan, do you want to just brief people again on the instructions for those who are on the phone versus the computer, please?
Yeah, absolutely. So raise your hand. You can either, if you're on the phone, you can press *9 to be able to add it to the queue. And if you're online here with us, you can just raise your hand using the little hand icon when you click at the bottom of your screen. And it looks like we have a question from Claire Warshaw on the line.
Terrific. Welcome, Claire. Do you have a comment or a question?
You're unmuted, Claire. You may just have to manually unmute on your phone as well.
Hi, can you hear me?
We sure can.
It's very nice to listen to your meeting. I'm a member of the public. I don't have any official association with the Alzheimer's community as in terms of the workforce or your group, although I have noticed a lot of interaction just as a public member and growing up. I had written a question I don't believe was answered live, but it says it was answered live. But anyways, please forgive me. It was written at the end of the last session. It says, since unpaid caregiving seems common and not officially recognized, is it possible that these trainings can be advertised more publicly? And the reason I wrote that is because it seems like people kind of accept a caregiving role, not necessarily even knowing it themselves sometimes. And it can be very challenging, and the balance isn't always there. Sometimes it's one person caregiving another person in the family. Sometimes it's the other way around, you know, depending on the stresses in a family, which change constantly. It seems that California and other places could benefit by kind of making it normal for people to want to access the kind of trainings that you might offer in terms of how to deal with home health care, but also introducing it in a way where the individual who might see an advertisement recognizes that they're in that position suddenly and they didn't really know it before, and that it's, you know, it's not always that solid, but something that kind of alerts people that there are ways of getting some help when you are in that position, and things can change where you might need that help too, you know, by somebody else. And it's nice when people have a caregiving knowledge, or a kind of a knowing that it's a kindness that everybody can utilize. So if it was advertised more in a way where people would not necessarily associate it as something like special, even though it is, but make it so that the average individual can learn compassion in a way that you might teach. And in a more public, you know, have it advertised more so that more public people would grab that training and look at it, not have to search for it when they're in crisis, right? Thanks. Sorry for all that. It's hard for me to explain what I'm thinking, but I think I got it through.
Yes, thank you very much for the comment, and we appreciate the additional thought about what could be included in that recommendation about making it available and something that people can easily access and feel comfortable accessing, no matter kind of what point in their life that they are in. So thank you for that. Are there any other comments on the recommendations? Okay, I am not seeing any. And we'll have another period for public comment just on other topics towards the end of the agenda. So I asked Susan, and she thinks the best protocol would be for us to, as the advisory committee, to approve the recommendations with the understanding that there were suggestions for improving them that can be incorporated by the committees that worked on that. So could I have a motion to do that?
So moved.
Thank you, Dr. Mobley. Is there a second?
Second.
Thank you, Sarah. Is all in favor of the motion, say aye.
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 And thank you. Is there any opposition and any abstentions? Okay, it is approved. So thank you very much. I really want to appreciate again all the committee members that worked on this, and for the really thoughtful comments that we received today. I thought that was really a terrific discussion about each of the recommendations, and I think we all look forward to having them presented at the California for All on September 20th, and hope that many of you will be joining us, not only to see the reaction to our recommendations, but to also hear the recommendations from all the other stakeholder groups that will be presented. So that is terrific. We are now going to turn to Jared, who is going to give us a legislative wrap-up.
Thank you, Catherine. Good afternoon, 12:01 afternoon, everyone. My name is Jared Giruso-Cloak. I am the Government Affairs Director for the Alzheimer's Association. Appreciate the opportunity to be able to provide these updates throughout this year on the legislative process that has concluded in some respects, but it's ongoing with legislation on the governor's desk. So I think I have a slide deck here, so I'll ask to move to the next slide. Thank you. So throughout this year, I've been providing updates primarily on 5 Alzheimer's specific bills that were introduced this year, 3 of which our association were the sponsors of, and then 2 additional pieces of legislation as well. But in addition to those bills, we, the Alzheimer's Association, have been tracking around 30 bills throughout the process that touch on a number of the topics listed here on this slide. And at this point, about half of them have not moved through the legislative process, whereas I think about 14 of those 30 bills are currently with the governor under his consideration to sign them. And I believe he has 12 days once it gets to his desk to decide whether or not to sign it, to veto it, or to do nothing, which would be the equivalent of him signing it. So we're anxiously waiting to see what will be signed and what will happen on a number of these key issues. Next slide. So for the Alzheimer's specific bills, I'll go through each of them again for folks who have been a part of this process. Some of this will seem familiar, and if this is new, you'll see some of the issues that the legislature has been working on over the course of this year. The first bill is AB 2175 that was authored by Assemblymember Rubio, which would have created a California Wandering Task Force. It was held in the first House Appropriations Committee, and one of the members of the advisory committee, Barbara, who represents Alzheimer's LA, they were the primary sponsors for this bill. And I'll just pause to see if there's any kind of updates on this policy or thoughts about what may happen next year.
Thanks, Jared. So this was a lesson in when you have a bunch of lawyers at DOJ just putting fiscal notes on your bills, you better write your bill very, very, very specifically. So we never intended this Wandering Task Force to exist in perpetuity, but they wrote a fiscal note that thought it would. So I think we're discussing it now, but I think we're going to take another run at this. And again, we're going to write a bill very specifically. And having conversations already with state DOJ so that we don't want, I think there was just some misinterpretations on their side because there is support within state DOJ for this initiative. So I think we're gonna revisit it.
Great, thank you. Thank you, Barbara. Next slide, please. So the next bill that I'm going to talk about is AB 1684 by Assemblymember Vopel, who is the Vice Chair of the Aging and Long-Term Care Committee. This bill would have created Alzheimer's Public Awareness Campaign. As many of you may know, there has been a funded Alzheimer's Public Awareness Campaign that was funded last year and is moving through the process. This bill would have put in statute the desire to continue to do this work. It was held in the second House Appropriations, so it got to the Senate and it was held there. No telling whether or not this will be brought brought back, or whether or not the assembly member will still be in the assembly next year. He's, I think, in a fairly competitive assembly race, but we know that he has been somebody very interested in this issue and decided without prompting to do something on this topic. So there was, we were appreciative of that and work with his office as well. And so we'll be working, depending on kind of what happens after the election, working with them to see if they'll continue to be doing this work. Next slide. So the first of the 3 sponsored bills that our Alzheimer's Association sponsored was AB 2583 by Assemblymember Mullen. This would have required dementia training, dementia-specific training for law enforcement. It would have worked in 2 ways. One, it would have embedded Alzheimer's into existing crisis intervention training, and then it would have required all officers by 2030 to have all officers by 2030 to have dementia-specific training. And it was held in the first House appropriations, so it did not move very far in the process. But we are actively looking at ways that we can reintroduce this same concept next year. Unfortunately, the individuals that we serve, as well as I'm sure many of you are aware of, negative interactions, unfortunately, between peace officers and individuals living with Alzheimer's and dementia. And we just feel very passionately that if officers have that understanding, those tools, that training, that wouldn't happen. So it's something that we'll be exploring for next year. Next slide. The our one bill that did make it to the governor is SB 861, which would pilot a dementia care navigation program within the Department of Aging through community health workers and promotoras. This is something that, throughout all 5 of our chapters, we've seen the incredible work of community health workers and promotoras to be able to share information related to Alzheimer's and dementia. And with the expansion of the community health worker benefit for Medi-Cal recipients, we thought that, being able to pilot a program that gave them the tools to help individuals navigate the diverse set of public and private supports and services, that would be a real benefit, particularly to disproportionately impacted communities. And there was approved funding for the expansion of the community health worker profession generally by the governor and the administration through another department, not the Department of Aging, but the Department of Healthcare Information and Access, where access and information, that we believe can help support this pilot program. I believe the bill has about 10 days left where the governor has the opportunity to decide on it, and we're optimistic that it will hopefully be signed and we can continue this work. Next slide. So then the last bill that I'll be talking about, and the one that we've probably talked to you all the most about, is AB 1618 by Assemblymember Aguiar Curry. This bill, unfortunately, was also held in appropriations in the Senate. It would have done 3 key things. It would have continued the Healthy Brain Initiative and placed that program in statute. Fortunately enough, the governor did propose, and ultimately it was decided to continue the funding for the Healthy Brain Initiative with $10 million in one-time funds that will expand the program to 12 counties, which we're really excited about. The bill would have done 2 other things, though. It would have created the Office of the Healthy Brain Initiative within the Department of Public Health. And it would have updated, most relevant to this committee, it would have updated the advisory committee membership. And I'll ask to go to the last slide. I think this is the last slide. And so some of the updates that we had proposed and in collaboration with the committee had thought through was increasing the members to include first responders, the Commission on Aging, primary care physicians, the legislature, local health representatives. Through deliberations with the Senate committee staff, there was a decision to give the Health and Human Services Secretary the ability to appoint additional members outside of those designations as well. But in addition to that, the bill would have conformed term lengths so that the representatives on the committee living with Alzheimer's or dementia, that they would be able to serve the same amount of time as everyone else. It would have uplifted diversity as a criteria for consideration of those who serve on this, as well as issues that the committee would look at. And also very importantly, it would have removed stigmatizing language from the statute, which, you know, the statute was put in place in the 1980s. And, you know, the thinking around Alzheimer's and dementia, as everyone knows, has significantly changed over the last 30, 40 years. And so we wanted to ensure that the language in that statute reflected the perspectives that we have today. And so because the bill did not move forward, we are still in the process of thinking through, you know, is this something worth considering for next year? The Healthy Brain Initiative, that funding did occur. And so that the need of that portion of the bill is probably less relevant. But based on the conversations that we've had with you all and the value of some of these changes to the advisory committee, we've been in conversation with the assembly member around whether or not they have interest in introducing a more focused bill around the advisory committee, and looking at the appropriations analysis for the bill. The updates to the advisory committee were never fiscally tagged in either of those in the Senate or in the Assembly appropriations analysis, which is, you know, it could change. You know, anytime a bill changes, the Appropriations Committee could look at it differently, but that gives us some optimism that this could be a bill that potentially avoids those fiscal committees. And with the broad-based support that we received this year, we'd have a really great opportunity. So I did want to leave it there, and hopefully I didn't talk too long, but also open it up for any questions or any thoughts around these updates to the committee, so that we can have that consideration in our discussions with the assembly member and our thinking for next year, and potentially running another bill on this issue.
Thanks so much, Jared. Does anyone have comments about updating the committee language and the composition? So not hearing other people's comments, I will say that I really enjoyed sort of the opportunity to provide feedback to Jared about particularly the stigmatizing language. And we had a small group of us that met to consider changes to the term limit so they were equal to other individuals that were any other member that was serving on the committee. And I think it's just kind of the time to do that kind of update and allow it to and allow the committee's authorizing statute to really reflect how we currently think of people living with dementia. So and trying to reflect better the diversity of California. So I think those are all really good amendments, and would love to see you consider having it go forward.
Great. Yeah, and obviously we still have a lot of time before next year. So if there are any additional thoughts, we'd love to, if we did move forward with trying to sponsor a bill like that, we'd want to continue to stay engaged with the committee and continue to receive feedback as it would move through the legislative process. But I appreciate that feedback as well.
Perfect. Are there questions about any of the other bills that that Jared mentioned, that people have questions about or comments about? We so appreciate you giving us updates at every meeting. It's been very helpful, I think, to help people feel connected to what's moving forward. I wanted to just raise one other bill that is also sitting on the governor's desk, which is Assembly Bill 1663. It's a Assembly Member Manshine bill, and I'm just going to give you a highlight of one piece of it. Because it provides the opportunity for what's called supported decision-making. That's an issue I've been passionate about for some time, sort of recognizing, like in the current construct, you're either viewed as capable of making your own decisions, or you might need a conservatorship. And there's a few options in the middle, such as advanced directive or durable power of attorney for healthcare, those kinds of things. But what supported decision-making recognizes is that people, when they have someone who can help them figure out their options, might actually be able to voice their own opinion about that with that kind of support. And in the bill, there are opportunities for the California Department of Aging to be one of the entities that has some responsibility for helping to think about what that would look like. So we don't yet know if the bill will be signed. It has other changes to the conservatorship process, et cetera. But many of us worked kind of to provide some input about the bill and to make it really work for individuals with dementia in addition to other disabilities. And I think it's an exciting opportunity. So if that comes to be, I think in a future meeting, it'll be interesting to have a presentation about what is supported decision-making, how could it be helpful to people with Alzheimer's and other dementias, and have a more robust discussion about it. So really just flagging it for people's awareness right now. And Andrea, it looked like you had a comment.
Yes, Jared, I would love for you guys to push through that AB 1618. Yeah, I think it's important. So I would totally agree with Catherine. But I did have a question in regards to the wandering bill.
Please go ahead.
Okay, so my question is in regards to the 20 members, do you know the experience that the 20 members have? Like, are they like mostly professionals or caregivers? I'm just curious about the members on that particular bill.
Yeah, that's a great question. They were largely representatives from the various systems that get involved with responding if someone wanders, but there were some seats for family caregivers, people who have had direct experience. So it was trying to make sure that everybody that's involved when, like I said, when a loved one wanders from the family themselves to law enforcement, to hospital systems, that we had some representation from those different systems on that.
Great, perfect, because yeah, I think that's perfect, just to get some feedback from others to understanding why you know, people wander. And usually when you have people like staff members or people that's caring for their loved one, there's so many different reasons why they wander, and that would be great input for helping with that bill, pushing that bill through.
Yeah, you're absolutely right. And I'll just also note that it wasn't only focused on people with Alzheimer's or related dementia, it was also inclusive of the autism community.
Good.
So we're already talking again with the various autism organizations because, you know, they are very interested in this bill moving forward as well.
Great, great, great bill.
Terrific. And Jared, it looked like you had a comment.
Just to note, so for AB Assembly Bill 1663, we were a supporter of that bill and spoke during a number of kind of public forums related to it. You know, obviously having more opportunities for individuals living with Alzheimer's and dementia not to just go to conservatorship, while that is a likely reality for many. You know, having that option was something very interesting to us, and we were really excited about the work that was being done on it. Just broadly speaking, if you know, we're able to, or anyone's able to continue to do these legislative updates for the committee moving forward, I know that I had kind of structured them to be more focused on Alzheimer's specific bills, but going forward, if we wanted to broaden that to other bills that either we're tracking or others are interested in, like bills AB 1663, we'd be happy to do that as well. So I just wanted to make those 2 points.
Perfect. Thanks so much, Jared. Any other committee member comments or questions? Really informative. There were 2 participants that said, thank you for the really helpful updates. So you're getting shout outs from all kinds of people for your good work. Thanks so much. And I think if there aren't other questions about this, then we will go to our second public comment period. I think Michelle let me know there was somebody on the phone with their hand raised, and then we'll take up our last 2 agenda items.
Yes, we have Aaron Levi on the phone. I've unmuted your line, Aaron.
I'm sorry, I do not mean to press that.
Okay, well, we're glad you're here and listening.
Yeah, sorry about that.
No problem at all. Thank you.
Great meeting. Thank you.
Thanks very much. Okay, and I don't think there's any other public comment, right? Michelle?
That's correct. I don't see any other hands raised in the system.
Okay, sounds great. So I think we can take, well, we can take down the public slide, the public comment slide if we want. We're now going to turn to making recommendations and items for the secretary. So what happens after each of these meetings is our staff puts together a letter that goes to the secretary, talking about the things that came up at this meeting that we want to call to his attention. So it's really our opportunity to just for each member of the committee or those that want to point out something to say what that is, so it can be incorporated into that that letter. So do people have thoughts about that? So I'm going to go back. I'll just start us off by saying I thought many of us spoke at the beginning of the meeting about the really expansive work that's been advanced in the area of Alzheimer's and dementia through the Master Plan for Aging and other budget items. And I at least want to express my appreciation for all of that was included in Susan's slides. And I want to just point out Dr. Mobley's comment about, the value of the collaborative efforts that among the different initiatives and among the different departments, and also encourage that there be sort of periodic outcome measures developed and reported on for each of the items. So I think that's one of the things that I think is important to share with the secretary. Do people have other thoughts? Barbara has her hand raised. So go ahead, Barbara.
Would you want to write into it the recommendations that are going to be coming out of this committee at the September 20 meeting?
I think, sure, that's a good idea. We can also say that the committee approved the recommendations and identify at least what the topic areas of those are. I think the secretary will be there for part of the meeting and have the opportunity to hear about them too. So, but good suggestion to include that in the letter that goes to the secretary. Other ideas?
Yes, I have a couple of recommendations, Andrea Robert.
Yeah, go ahead.
Okay, this one is regarding SB 48.
Okay, tell us about that.
Yes, so my recommendation, the recommendation is really good in regards to the cognitive health assessment. I would love for them to consider also people 30 and over to be considered for those cognitive assessment, because more and more younger people living with cognitive impairment, it would be nice if we can also be assessed yearly if a person is showing signs.
Okay.
Okay, and then my other recommendation, I did notice that part of the initiative for IHS workers and different workers that work with people with dementia, Alzheimer's, I noticed that they did not put in monies or they did not approve for any academic or licensed professional training. And I would ask they would reconsider that in regards to providing community college education in regards to people that are providing care for people living with dementia, Alzheimer's, because a lot of the certificate programs that's out there now, they continue to perpetuate low income wages. So I think that it would be important if they would reconsider or maybe look at it the next cycle in regards to make an opportunity available for people to bridge into community college license and certification programs.
So Andrea, that sounds consistent with the feedback that you provided about the recommendation in the first recommendation about the importance of community colleges being a career path for all direct care staff. Am I getting that right?
Yes, exactly.
Okay. So I think we'll have that covered with our recommendation 1. So I think it'll kind of come together nicely to be clear about that.
Okay, great. Thank you.
Thanks so much. Other comments that we want to give to the secretary? I think the second thing I would raise is our interest in updating the authorizing statute about the committee to remove kind of the stigmatizing language relative to dementia, to equalize the terms of people living with dementia with other caregivers, and support ensure that the committee reflects the diversity of people living in California. So those were the changes that the committee had worked with, particularly with Jared in the bill that he was talking about. So I think we could include that as one of the recommendations and see what opportunities there are, both with the work that the Alzheimer's Association is doing and with the secretary to achieve those kind of outcomes, which I think would be really terrific. Okay, I'm not hearing any other comments people want to make for the secretary. Okay, let's turn to our next topic, which is December meeting topics. And I think I'm first going to note that there is consideration of changing our meeting schedule for next year. This is our last meeting for this year, and we would typically start with a meeting in December. One of the observations is that when we meet in December, the CDA staff isn't really able to talk about what might be in the budget or what the proposals are because the budget hasn't been released yet. So if we were to meet in January instead of December, we would be able to get a more robust meeting update about what's pending in the budget, and then we would have our meetings every other month after January. So I think more to come on that, Susan, right? Is that the plan? So there'll be something circulated about, are we going to cancel the December meeting or just postpone it until January, and then some inquiries about what dates work for people to participate in that meeting. But regardless of whether it's in December or January, we want to make sure we cover the topics that you want to have included in the meeting. One we've talked about, and we now have, I think, quite a group that can help us plan, is the discussion about the intersection of Alzheimer's and other dementias with people with intellectual and developmental disabilities, particularly people with Down syndrome. And so we'll be putting together in the interim a smaller group. Michelle, I think, has volunteered to help us put that meeting together, a subgroup meeting together. So it'll be Dr. Mobley and Todd, and maybe Todd Molly as the provider. And we've talked about engaging the Department of Developmental Services or one of its regional centers to also help that. So we'll carve out some time to do that presentation. And then the second topic I heard was to maybe take a deeper dive into one or more of the workforce areas that Susan talked about as part of the current implementation. And then, of course, if we're meeting in January, we'd love to hear about what's happening in the budget, I think. But let's identify any other topic areas that people are interested in. And Barbara has her hand raised.
Sorry, I keep doing that.
That's okay. I can't, for some reason, my screen will not enlarge, so I can only see 6 of you at a time. But okay. I get this little thing that says somebody raised their hand. And after you is Celine.
Okay. So a couple of ideas. I would love to hear from Department of Public Health staff. You know, they have a lot of the previous cycle. There were a lot of funding, a lot of different programs that went to Department of Public Health. And now we're far enough down the road that they might really be able to give us a sense of how these programs are unfolding, the status of that. And then, and this might be premature, so we might want to pen this to another conversation, but I don't think this committee has ever had a really focused discussion about dementia-friendly communities, kind of broadly. And there's two different places that money is now. There's Department of Public Health has it from the previous cycle, and now CDA also has some funding, and there's some connection and some difference between those two. But anyway, it might be kind of interesting to have a more focused conversation about what those two agencies are doing in this space and what recommendations this committee might have for, you know, guiding the state's support of dementia-friendly work.
Sounds great. Thanks for the feedback. Celine.
Yeah, and just on top of that, you know, just because one of the goals was also the blue zone, so there's a lot of intersections and cross sections of that. But my, I don't know if this would be appropriate, but through the ACL, the Administration of Community Living, a big focus of their work is the IDD population, and so we were a grant recipient of that. And they have a whole national resource and best practices across the United States, and I you know, they might be willing to come and speak to the work that they've been doing as a panel member.
Oh, thanks for that. They even have a region, I guess it's 9 office in San Francisco.
Region 9, yeah.
Yeah. Derek knows. I think he used to work there. So
that's right.
That's great. Yeah, perfect.
I can extend an invitation to, you know, any project officer and see if they would be able to join us.
Perfect. Yeah, thanks for that.
Yeah, we work with Heather Mean and Aaron Long for our particular project, and us and One Generation were awardees this past time.
Good.
You sound like you might have some information to share too, so that's great. Okay. Other thoughts for next meeting?
Sarah actually raised her hand.
Oh, thank you.
Sorry. Yeah, I would love to hear about the Healthy Brain Initiative, especially since it sounds like there was a new funding, a one-time $10 million funding, and how that's going to be distributed. So that's of interest to me, and I think relevant for the California Alzheimer's centers too.
Terrific. Derek, did you have comments too?
No, actually, Susan has raised her hand.
Okay, thank you. I don't know why I am no longer getting messages about people raising their hands. I don't know. There's some update going on with Zoom apparently that has made everything a little unusual today. So I'm sure it'll be sorted out. Go ahead.
Yes, apologies for that. I did want to mention also that since we were talking about the Administration on Community Living, that they on September 21st, they're unveiling the National Caregiving Strategy that is a result of the Raise Family Caregiver Act. And we're closely following that and plan to have caregiver convening in early October. But in light of what your recommendations are going forward, that's something that we look to really build from in the coming year.
That's terrific. Thank you. Thanks for the update. Derek, since you can see hand raised and I can't, maybe, Scarlett, okay, there's a public comment, I think, from, somehow I'm getting the Q&A part. No, there's nothing there. So Scarlett has a hand raised.
Scarlett Quarles.
Yeah. So I think she's a member of the public, I think, but that's fine. I think happy to get her input.
Okay, can you hear me now?
We can.
Okay, this is Ashley Tia Delaney. I work for the Alzheimer's Association. So hello, everyone. I wanted to know, because I can't see who's actually on the council, is there anyone that represents faith-based organizations that sits on the advisory council?
I don't think there's somebody that's identified as a representative from that community. Did you have a comment about that or?
Well, now that I know the answer, yes, has that been a consideration for this council to have someone that represents our faith-based organizations to be part of this advisory council, especially when we're talking about advancing equity and thinking about inclusivity? You know, Los Angeles is, as we all know, a huge melting pot. And with a lot of people, especially in the Black community, you know, faith-based organizations are a part of our support system and help guide some of the decisions that we make when it comes to care and support and resources. And so just think that would be a good consideration for a member of the advisory committee.
Thanks so much for the feedback. And I think many of us who have done lots of outreach and work with communities certainly value what faith-based organizations bring and their connections. So thanks so much. And then it looks like Wynn maybe had a comment.
I don't know if you mentioned it, I might have missed it. Something to be reminded about the capacity aware in a way, in alignment with the supportive decision making that you talked about with people with dementia. We need to figure out a way to educate everyone on how that's done and what happens after such evaluation. That's all.
And I think an interesting intersection with supported decision making is a realization of what is capacity, because you may be able to make part of a decision, but not all of a decision, or you may need help making a decision, right? And so I think there's wisdom in what you're saying in terms of thinking it in a broader way, right? Then it's not just yes or no, there's gradations in there, I think. So appreciate that. I think we could have an interesting discussion about supported decision making and capacity at a future meeting. So that'd be great. Okay, other comments from people about our next meeting?
There are no hands raised at this point.
Okay. Any final words before we adjourn? The only comment I'll make is those of us that worked on the recommendations, we need to finalize those by tomorrow morning. And then Derek and I can adjust the slides that are being used on the 20th. So I will take responsibility for adjusting recommendation 1. I think Derek and Meg can each do 2. Wynn, if you want to see the adjustments to 1, I'm happy to shoot it your way. I'll probably do it later on this evening. So just let me know. I'll just send it to you, and if you want to comment, that's fine. Make sense? Okay, and then there was one other comment, I think. Sorry.
No, it's okay. I was just going to mention that.
And that is from an attendee who
Yes,
maybe
Claire Warshaw.
Oh, Claire Warshaw. Okay.
Hi, this isn't really about the next meeting that you're having, and I don't know if I'll be there, but this is the first time I've attended one of these meetings before by your organization, and I wanted to thank your staff and for talking and updating everybody on what is going on. I also wanted to give an analogy, because I think it's, sometimes diagnoses and things, they seem really solid, and sometimes from what I've noticed, they're not necessarily, but the work that you do can be very broadly applied to other situations. And the analogy I want to give is, I had a partner, and some of you may have known him, Tim Follis. He passed away in 2020, but he was a LVN, and he did a lot of caregiving and worked at El Hogar for a while and things like that. He was a street nurse for a while with the homeless people. And when he was with me from like late 94 until 2010, he started working on ADA improvements for people with disabilities. Improvements like helping businesses make sure they complied with all of the ADA laws. And what the analogy is that he was really focused on ADA, but that work that he helped those businesses accomplish helped a lot of other people. It helped mothers that had like baby carriages and, you know, people that, I don't know how to explain this, but, you know, people that are pushing carts down the street, elderly, you know, with sidewalk cuts and stuff like that. And in a similar way, your work also, like if you do trainings for caregiving, and it can be seen as something that people can latch on to easily, you're going to affect others in great ways, and not necessarily because they have Alzheimer's or dementia, but it can be broadly applied in good ways.
Yeah, thanks for the comment. I'm a big believer in creative and inclusive communities, which is really what I hear you talking about as well. And, you know, creating a dementia-friendly community, creating increased accessibility, really in the end benefits all of us as we go through the lifespan. And so I really appreciate your comment. Okay, any other comments? Not hearing anyone, so I'm going to give you.
I just
20
have one, and I wanted to
Yeah.
thank Catherine and Derek for their leadership today and between meetings. You both have been putting in a lot of hours to get us ready for today and to get ready for September 20th. So thank you both for
Great.
being volunteer leaders and giving your time.
You are so welcome. Great partnership with you and all of your staff.
Absolutely.
Okay, thank you, everyone. And we're going to give you 20 minutes of your day back. So I've never heard anyone complain about that. So thanks very much for joining. And hopefully we will see many of you on the 20th in person or virtually. Thanks so much.
Thank
Okay, bye.
you.
Bye, everyone.
Bye-bye.
Thank you. Thank you. Bye.
Bye.